Hi, everyone. My name is Steve Lawson.
And my name is Anya Fofana.
Welcome to the live demo sessions where we're highlighting our intelligently efficient solutions. Today, we are live from our global headquarters in Waukesha, Wisconsin, and we are on our SIGNA Pioneer Bay. Today, we'd like to show you some productivity enhancements you can do with neuroimaging with Hyper and HyperSpeed, HyperSense, and so on.
So we have our volunteer already lined up here on the table, and we will use for today's scanning our 48-channel brain coil. And we want to just highlight a few things about the 48-channel coil. So as you can see, it's really a nice and wide coil. Our volunteer has really a lot of space in that coil. So most of the heads actually fit in that coil. You don't have to worry about any head you might have that doesn't fit in. So this coil is really big, and you can use it for most of the patients. Another big feature is that we can use the comfort tilt underneath that coil. So in case your patient is older and cannot bend over that much anymore, you still are able to use the comfort tilt on that underneath that coil, which is great. And then what we do have on top of it is a spacer. So this coil has two parts. It has a posterior part and an anterior part. This coil is divided really in two different pieces and has two different ports, so that technically this coil are two coils. And that is why it doesn't have to be used together. So what we can do now is just put a spacer in between for really big heads, and maybe for just patients who has an intubation here, you can just leave it as Steve shows, just between there.
Better?
Can we do that?
Oh. Sure.
It's good? What?
I'll just...
Yeah, can you just change it?
Sorry about that.
Connected to headset.
Okay, now you should hear us again. So we can use as we mentioned, the spacer in between the coils, really wide and big head, and for patients who are intubated. But usually in the normal life, you don't need that. So that is why we are using now only the anterior and posterior part. And as we said, it's two coils technically. So what you could also do is just use the posterior part, for example, of the coil. So think about the use case where you want to switch from head exam to an abdomen exam and back to head exam. You don't have to remove the coil entirely from the table anymore. And since both coils are having plugs, you can just leave the posterior part in and then just go ahead and scan wherever in the body with always the coil plugged in. So as Steve shows, we have these 48 channels split up about in two ports. Okay, for the first scan, we will tilt our volunteer's head to one side slightly. So that should symbolize the real life scenario where you do have to examine a stroke patient. And we want to use for the first sequence our very first deep learning technique in the brain to help us prescribe the slices. And then we want to repeat the scan after the first scan to show you how sufficient RX is prescribing the slices. So it will always find the same slice description, no matter how your patient is in the board. Okay, so we covered him, and we have everything perfectly set up, and then we to give him the squeeze ball in his left hand, and then we can go ahead and start the scan.
People in the meeting know that you are busy. Yeah, I think.
Yeah. It automatically will come.
Okay.
Okay, now you will see our user interface in just a second. So in that user interface, I've selected already the patient, and I have already selected the right protocol. So I just go ahead and start the exam button here. First of all, for sure, we have to run a localizer, and I want to show you quickly our new user interface regarding the coil management. So you do see here that the head coil has two parts, as we just mentioned, the posterior part, the anterior part, and we do have the PA coil. And then we just go ahead and run the localizer, and it will be a normal 3-plan localizer. So nothing really special, even though we don't have to use a different localizer for that. We just run a 3-plan localizer, and based on that 3-plan localizer, AirX will find all the landmarks in the brain. Another thing which we want to mention real quick before we start scanning is that our 3T scanners all will have SAR management for the brain, and will run every single time when we're doing a head scan SAR localizer, as you can see here. So without me doing anything, the system will kick in a SAR localizer whenever we have a patient in the bore, in the head coil, and we do a certain landmark. The system knows we are going to scan ahead. So that is why we let a SAR scan run to really estimate the perfect SAR amount for that patient with his weight in the bore. So we can really be very efficient with the SAR management for brain scanning, and you will not run into any SAR issues while scanning. That is really nice. And as you can see, the head is really tilted to one side. So I will launch the first T2 image. And as you can see here, AirX did a perfect job in finding really the field of view. So actually, I would have to rerun as a technologist a different localizer to find those lines here to make it perfect. But since we are using AirX, I don't have to rerun the localizer. I can trust the scanner. So here on the user interface, you see that the protocol has been saved with the anatomical reference ACPC line and actual planes. So I don't have to do any mouse clicks. I can just reassure that the slide description has been done right. And then I'm going ahead and save the scan, and we can start scanning it. And then for the next test, we will just reposition the patient into in a normal position, just straight, and we will repeat the same exact scan to just compare the images and the slide description on that. So AirX is, as we just mentioned, deep learning based, and it has been trained on 36,000 localizer, and that was kind of our first deep learning on the scanner. So the nice thing about AirX is, as we mentioned at the beginning, we don't have to use a different type of localizer to acquire those slides description. We have to run our normal 3-plan localizer. And then after the first localizer, all the landmarks have been already found. So there's nothing for me to wait for or to do additionally when I decide to maybe run other landmarks than the ACPC line. All the landmarks have been found already after the normal 3-plan localizer, which is really huge and really efficient.
And for the user, when they build their protocol and they save their protocol, they just simply save those anatomical reference points in the protocol, and then just simply opening up the protocol, you'll see that it will automatically be prescribed for you. So the user doesn't really have to do anything other than just open the protocol and then start the scan. One other comment about the 48-channel head coil. We built this, as we mentioned, with the design to being very open and very large coil. very large aperture to fit very large people. We worked with the NFL collaboration with this coil to fit NFL football players. So you can imagine some of these guys in American football are quite large. So it fits 99.9% of all of those people. Very nice.
Okay, now I went back into the scan room and I repositioned his head to make it straight. And then we do exactly the same thing, and we'll see how precise RX really is. Now I did a quite better job at positioning his brain, but as we said, like the first scenario does happen quite often when you have really a sick patient with a tumor or with like a fresh stroke. They are not able to hold their heads straight. So that is why we try to show you like the real life scenario here. So again, I will just launch my T2 image, and it's exactly the same. And you see here again how perfectly and precisely the field of view has been angled. And now I can really here also on the sagittal plane see the ACPC line. I wouldn't do anything different, so I will rerun that scan as well. And then we can do the comparison. As we said, more lines are available, or more landmarks are available. Here is another example which we want to show you, where we can look for the pituitary. So here the selection is pituitary, sagittal plane, and as you can see, it already again finds really perfectly where the pituitary is. I don't have to worry about that. Also, the field of view has been angled that no matter where the nose is, it's always like straight, which is really nice and convenient for you. And here we were running a scan with really only 2 millimeter slice thicknesses and an in-plane resolution of 0.4 by 0.4. And that is kind of our second deep learning technology implemented on the scanner. That is why we use AirRecon DL for making images in less scan time or really fast scan times, while we can use a technique where we train the model to recognize and understand a noise in an MR image. So it will remove that noise out of the image so that you can like really go with parameters which helps you to be efficient and fast. And you don't have to worry. Usually you have to always worry to generate too noisy images. So you would have to add more averages or less resolution to have still good images. But with AirRecon DL, you can generate these images way faster because we can remove the noise out of the images.
Hello.
So, yeah.
Hi.
Is there a question? Okay, so here's the example where we have in both scenarios the same volunteer and the same slice description, ACPC line. But in the first scenario, the head was really, really tilted. And in the second scenario, the head was pretty much straight. And you can see how consistent the slice description is made. And all based and made on the really like angled localizer in the first scenario. So it shows you really how nicely and helpful that tool is to consistency regarding slice description, and also like to help you to be efficient, because usually when patients are coming back to have a rescan or a follow-up, you always have to look at the old images and have to have them on the scanner. And now with RX, you don't have to do that work prior. You can just use RX the entire time, and then you will know for sure that the slice description is done in the same way. So the pituitary is running, and I just want to show you, we don't have to scan it, but I want to show you like which else slice description are available. So we do have, as we talked about already, the ACPC line, we have the pituitary, but then we have also, as you can see here, the temporal lobe. So when we go really to a very, very lateral image here, and where we can see the temporal lobe, you can see how precisely RX will find that landmark and just go from the very first slice starting in the temporal lobe. And then other landmarks are the inner ear, for example. The OM line is available as well. Then orbits and optic nerve, and also, which I think is really helpful, the circle of Willis, because how often does it happen that maybe like new coworkers are on scanning and they don't really know where the anatomies are. So if you use an RX and just state the protocol with that landmark here, you don't have to worry that arteries get cut off, which is really nice. So the next scan, we talked about a little bit already about Ericon DL, and in the first scenario I showed you always how you can use Ericon DL to be very fast. So we did the first two images here in 44 seconds with a decent in-plane resolution of, we ran through the entire brain 4mm slices, and the in-plane resolution was 0.7 by 0.7. But here I will do a really high resolution scan. So we do have an in-plane resolution of 0.5 by 0.5, and we will cover the entire brain in 3mm slices. And we still only have a scan time of 1 minute 49 seconds. And that is only possible because we will use Ericon DL, because we are using, again, the deep learning to remove the noise out of the image. I will show the first example how the images look with and without Ericon DL. So that was the first image we acquired. On the left-hand side, you see it with Ericon DL, on the right-hand side without. And I make it a little bit more easy on you, so I will zoom in so that you can see how the images look differently here. When we really look at like tiny structures, you can see here is the image still with all the noise in the image, and then deep learning understands what part of the image is noise and removes it, and then you will see the result on the left-hand side. And Ericon DL has been used in the first use case for just being fast. So we reduced the scan times by using less averages when reading out the MR images. We accelerated slightly higher. So you can see really how nice all these structures now are shown up without having to look at the noise on top of it.
Question. Just high, low, or medium?
So we show all the images today with the setting of the recon strength of high. For sure, if you are new to an Ericon DL, you might want to like not remove that much noise from the very beginning. So we have different settings available. The other settings available are called low and medium, where kind of like for the low setting, you will remove around maybe 35% of the noise, and then medium, you remove 50%. And here with the setting to high, we will remove about 75%.
One other really strong advantage here is we're able to remove some of the ringing artifacts that you commonly see. So if you go kind of to the posterior part back here, where you see a lot of small edge ringing in the original data, that's also removed as well. So those subtle artifacts can be removed.
Okay, now we showed a lot about Ericon DL already, and the next thing we want to talk about is how to optimize in our speed in 3D sequences. So here for the top sequence, as you can see, we do have really in-plane resolution again, which is pretty high with 0.5 by 0.5 millimeter, and we acquiring the entire stack in 0.6 millimeter slice thicknesses. And we can do that in 3 minutes and 4 seconds because we are adding HyperSense to the protocol. HyperSense is our sensing technique, and you will find that in the acceleration tab. And since the resolution is that high, we can use a HyperSense factor 2.5. So I will just go ahead and run that sequence. One other mark here is I don't have to prescribe again because RX does prescribe the slices with set to circle of Willis in actual plane. So I'll just go ahead and start that scan too. And then I will go ahead and just open it up. I will not scan it because we don't have that much time. But when I would remove HyperSense, you see that the entire sequence will take 7 minutes and 40 seconds.
We have a great question from Joe S. in the chat. He's asking, is AirX available in other coils or just head? So we have AirX also available in the knee as well. So that's really nice for being able to, set your planes up axial, sagittal, coronal. It also does meniscus views of the cartilage. It will also do a patella view. It will do ACL and also do PCL as well.
And for knee, we can use any coil. So that's huge too. So you don't have to have the dedicated knee coil to use RX in the knee. You can do that with flex coils. You can do that with MP coils or whatever.
And in the head, you can use any head coil that's available too.
So here's the example of air recon DL used in those two different ways. Left-hand side to be fast, 45 seconds for still a good resolution, but if you want to be really high resolution, right-hand side, we do 3 millimeter scans, and the scan time is still only 1 minute and 48 and 9 seconds. So I will just scroll through the images, and you can see how much more detail you can see here and how less noise you have, because again, we are using air recon DL. And just to give you an idea of how much noise that image would have when we wouldn't use air recon DL, I will load the images now without air recon DL on the left-hand side. So it is here. And now this is without air recon DL. This is with air recon DL. I will zoom then in again in the same spot so that we can have really a comparison. So it's kind of the same data sets, but with and without air recon DL. And it's so much easier to look at the tiny little structures here when all the noise has been removed, I think. I think my eye is not as tired at night when I go home than it usually is. Okay. The top sequence is still running. Then I want to show you another idea of how you can use acceleration techniques on 3D. I want to show you that on an example of a cube sequence that time. So I will do a cube T2 weighted inversion recovery technique flare, and I will add fat suppression here. So this entire 3D volume has again an isotropic voxel of 1 millimeter slices. And we do have a scan time 3 minutes 38 because now we still use HyperSense, but we add another HyperWorks technique here to end up with that scan time. We did add HyperCube. HyperCube is enabled here with the excitation mode to focus. And when I've set that to focus, then the phase direction or phase encoding direction, which is here anterior to posterior, will not read out 100%, and we only read out here 90% of that. That again shortens down my scan time and also helps me to not have to worry about oversampling and stuff like that. So the nice thing is that we can have all the HyperWorks method combined, and you can always feed your sequence with those methods to make it perfectly in that anatomy and also for your needs. So it's not that you only have to use compress sensing or you only have to use HyperCube. When you want to use that together, you can. So, and again, here I want to show you the example by just removing both of those features so that you can see what difference it is not accelerating this 3D sequence. So we will end up of a scan time now here with 5 minutes compared to 3 minutes and 38. So I owe you still the image of the pituitary. So I want to again show you the difference here with and without air recon DL. Again, we had really fast scan time, only 1 minute and 25 seconds. And you see here on the user interface that we acquired 2 millimeter slice thicknesses. So usually when you want to have no noise, then you would have to acquire at least like a 3-minute scan, I would say. But now with air recon DL, you don't have to worry about that. You can just go ahead and scan with air recon DL and be as fast as 1 minute and 25 seconds. And I think it's nice how also RX does the job in finding the pituitary. I wouldn't have prescribed better. I have to admit that. So actually in-house, we were trying always to be better than the machine, and we failed every single time. So that is why we appreciate really RX a lot, because we know that we can really work efficient. And I think there's so much other things in MR where you can have to play with that I don't mind that somebody prescribed the slices in a perfect way for me.
That's right. There's a nice video that we had put on the virtual booth. If you guys want to see how we had our experiments with AirX, we've done several different head positions, and we tried to beat the machine. We just simply couldn't.
So here's something exciting too, because now with the latest software release, we can also combine other 3D sequences with HyperSense, and our MP Rage here now is also able to be accelerated with HyperSense, as you can see here. So we will run that MP Rage again in a pixel size of 1 millimeter by 1 millimeter in all 3 dimensions, and we will end up in the scan time with 3 minutes and 38 seconds. And then while these are running, we can go ahead and look at the top MRA image. So here are the original data, and I can just maybe scroll through real quick. And then I will show you the 3D image as well. And this has been done like without cutting off anything. So I will go ahead and maybe cut off the bone, because we don't need that right now. And then you will see how much more signal you even have. Maybe the nose as well. Okay. So all done in 3 minutes and 4 seconds with 0.5 by 0.5.
I'd also like to highlight that that resolution is truly acquired resolution. That is not any interpolation. There's no interpolation applied to this scan at all with the resolution. So it's true 0.5 by 0.5.
Yeah, and as we saw, when we wouldn't use HyperWorks, then the scan time would be around 7 minutes, and that is why nobody would scan that in real life,
Yeah,
because
no one scans at that resolution really without HyperSense.
So it's really fun to have now all these tools available to give your patient a lot of comfort, and you have images where you are working with resolutions which we have dreamed of like years ago. Maybe just quickly, another acceleration tool which we use for our diffusion, API diffusion technique is Hyperband. Also, you can use that for DTI tensor imaging and combine it with Hyperband. Here's just an example where we like speed up a normal diffusion. So you can see in the acceleration tab again, Hyperband has been selected, and we end up with a scan time of 26 seconds here for standard diffusion. Okay, now we have time to look at our 3D acquisition for the cube, and I want to like just go here to a different layout, and we'll load the cube. And we will look first at the sagittal plane. Okay. Where is it now? I just loaded again. Now we can do it. Okay. So here is the cube we acquired sagittally. Then here the first reformat in axial plane. And then here the other reformat in coronal plane. All done like in millimeter slice isotropic. So that is like the acquired plane of, and then here are the reformats, and I will show you maybe slightly thicker slices of 1.5 millimeter. So you see we've covered the entire brain with like really thin slices. You can do the reformats however and wherever you want, and you will still get a decent image quality. So technically there's really no need to acquire an inversion recovery like in 3 planes anymore. You can just do one 3D scan and then just reformat however you want.
And Cube is available in many different contrasts as well, right? So you could do sagittal, or you could do other planes too, but T1 fast spin echo, T1 flare, T2 flare, dual inversion recovery, stir.
Dixon,
Yes.
did we
Yep.
say that too?
You can also apply Dixon to these two, so that's.
And you can do it anywhere in the body. So we are not limited to do it in brain only. You can do it wherever you want. That is also nice. So if you want to do a scan in the pelvis, you can use a cube sequence in the pelvis, for example, as well. See, as you can see, you can like find any angle and you will never see any reformat issues. We have really nice reformats everywhere in the brain. Okay, the last sequence is running, and I think we are already, we are running out of time. So maybe we will just making sure that we don't leave any questions unanswered. So feel free to ask us any type of questions. If there are any questions, please let us know.
So HyperSense being added to the MP Rage, that's new for this RSNA, so that's something that we're talking about. You can apply that on Bravo, MP Rage. You can do it on Fiesta C, Merge, Gradient Echo. That's kind of popular for musculoskeletal imaging. You can also apply it for a scan called Mensa, which is like a Gradient Echo 3D scan. Really nice for MSK imaging as well. But HyperSense is new to those certain Gradient Echo T1 based applications.
Did you mention lava and Vibrant too?
Yeah.
That is huge, I think, too, and that's worth mentioning.
That's kind of the biggest one, probably.
Yeah.
Lava, lava in the abdomen for your T1 weighted contrast. You can do lava with FatSat, lava flex, with HyperSense now, disco lava, disco flex lava. So that's nice for abdominal and body imaging, maybe prostate imaging as well. So.
And maybe I should just give 2 more sentences about AirRecon DL. That is available on our entire FSE family. Also, gradient echo-based sequences are available with AirRecon DL, so our single shots. And also for the latest release, we are able to do diffusion imaging with AirRecon DL as well.
And both these two offerings of HyperSense being expanded and also AirRecon DL is also available across the entire portfolio as well. So either 1.5T or 3T system.
Vibrant.
Another question.
Vibrant.
Vibrant as well. Forgot that one as well.
Good. The people are listening.
Keeping me on my toes. Thank you.
So here's the MP Rage done with HyperSense. As you can see, also the reformats look really, really nice, and all was done in 3 minutes and 38 seconds. And then I'm going to launch here the last sequence, the diffusion we did. And then we can have a look quickly. I don't want to go over time too much, but I want to show quickly here the nice V2 images. And then you can appreciate really the less distortion here. And I want to switch to the 1000 V value as well. So all done in 24 seconds. Okay.
Well, that will conclude our session for today. So afternoon at 1 o'clock Central Time. So we'll be highlighting more intelligently efficient features of our platforms.
Thank you so much.
Thank you.